Welcome to our 5 on 5. Please be joined today by Freddy Sennhauser, VP of Marketing and Communications for Allcare Health. Freddie, good to see you again. How are you today?
Great. Thanks for having me.
Yeah, thanks for being here. So, a lot of things happening right now. I want to first start with the differences between original Medicare and Medicare Advantage.
Yeah, it's the original Medicare is a program where Medicare beneficiaries get their care directly through the federal government, and Medicare Advantage is the program where beneficiaries can go to an insurance company and get their coverage, their Medicare coverage through the insurance company. And what's exciting about that is that Medicare Advantage offers many, many benefits that original Medicare does not offer. And the enrollments in these Medicare Advantage plans has gone up exponentially. People really like that. They have choices. You can pick between companies in different areas. And of course, premiums are different too. And then they can pick, the beneficiaries can pick the benefits that one company offers and one might not offer, like dental care or routine eye exams, eyewear allowance, things of that nature that make it really exciting.
Okay, and what about the changes that are happening with Medicare Advantage right now? I understand some things are changing there.
Yeah, the neat part is that now we are allowed, these insurance companies that offer these Medicare Advantage plans, to offer innovative programs. For example, acupuncture, naturopathic medicine that original Medicare doesn't offer.
Sure.
Home-based palliative care, non-emergency medical transportation, meal benefits. So if a beneficiary gets discharged from the hospital, for example, then the insurance company can provide a hot meal per day, or fall prevention. So where an insurance company hires certified professionals, they go into a beneficiary's home, assess the risk for falls, and then if they determine, this person is really at risk and we need to make some changes, the insurance companies are now allowed to purchase bathroom safety devices, for example, a grab bar or a transfer bench, things of that nature, which really is, makes so much common sense. If you can avoid a hospitalization, the health of the members is, of course, improved by that, and the insurance company eliminates a huge cost.
Yeah, exactly. Once they go into the hospital, that's skyrocketing. Okay, well, we're going to take a quick commercial break. Much more to talk about. Stay with us. We'll be right back. Welcome back to our 5 on 5. We're going to be here with Freddy Sennhauser, VP of Marketing and Communications for Allcare Health. So we're talking about Medicare, Medicare Advantage, and some of the differences. But I understand Medicare Advantage enrollment period, is that happening right now?
Yeah, it just started mid-October and ends on December 7th. So folks have a few more weeks to work on that. And what's neat about the changes that are just happening with this enrollment period right now, it's called the annual enrollment period. Medicare now has created a new one for next year. It's the open enrollment period. So if folks make a decision that they might regret during this time of the year, they have an option for the first 3 months of next year to make a correction.
Okay.
And so, we talked before about additional benefits that folks could purchase, and suddenly they realize, whoa, this company has this, and I'd rather have that. So next year they could then make a change. And that just is one of the things that Medicare Advantage brings to the fore, is that folks have choices where you don't necessarily have that with original Medicare. There's just one program.
Yeah, and flexibility. Everybody loves that. Okay, so obviously you're breaking it down for them a little bit, but you can't talk about everything. We don't have enough time to be here all day literally covering this stuff. What advice do you have for people if they have questions about Medicare or Medicare Advantage?
Yeah, there are actually 3 different avenues. Folks can go on Medicare.gov. That's a website run by the federal government. Very helpful, lots of features, and can really tailor their program through that. Or folks can call SHEBA. That's a non-profit agency funded by Medicare, run by volunteers. They give objective advice. Okay. And then most certainly beneficiaries can just call their insurance agent and say, hey, help me through this. The insurance agents, of course, have a lot of experience, and they know most of the companies pretty well. And so they are pretty good guidance or navigators helping the people through this process. Okay,
and obviously I'm sure they can reach out to those resources to get the answer to the question I'm about to ask you, but hopefully save them a step. Where can people sign up for this stuff?
You can go to the website, for example, Medicare.gov. That's easy. Or in many cases, just go to the insurance company. If they already know the plan they're with, want to make some changes, they can either just stay, don't have to do a thing, or go to the insurance company's website and enroll there. Each company has an enrollment feature that allows them to do that. Okay,
well, it's good to have you here breaking it down for us in the middle of this enrollment period. But as you said, flexibility. You can come back early next year and tailor the plan for you. Good to see you.
Yeah,
thanks for being here.
Thanks for having me. Thank you.
Stay with us. We'll be right back.